Hi, I'm Laura. Let's take a look at nutrition and cancer and how they relate. The American Cancer Society estimates that 1 in 3 Americans will face a cancer diagnosis at some point. Diet is one of the few risk factors we can try to control for ourselves as opposed to age or environment. But the science linking nutrition and cancer is nuanced with limited clear causalities. And spoiler alert, the main thing we can do is eat a diet that's complete, heavily plant-based and varied, along with staying active and trying to avoid excess body weight. I'll be giving a very basic summary of what the evidence most supports for cancer implications of excess body weight, specific foods, specific nutrients, and nutrition for cancer patients. We can't cover nutrition and cancer without mentioning excess body weight. It's most clearly linked to at least 13 cancer types and to about 7% of all cancer deaths. Why is this? It's thought to influence chronic inflammation, hormones, and things that influence cell growth. But importantly, research on whether weight loss reduces cancer risk is still limited. So the association is clear, but it's not as well understood as we'd like. Next, we'll look at specific foods and well-known diets. There's a huge amount of unreliable information on this topic, but some food scientists are most confident will increase cancer risk are red meat, ultra-processed foods, high heat cooking methods, and alcohol. A little spotlight on alcohol. Most people don't think of it as a carcinogen, but it's been debated due to some conflicting studies, but a consensus is emerging that it's actually a causal factor in at least 7 types of cancer, drives a non-trivial lifetime risk increase, and it played a role in about 5% of cancer diagnoses in 2019. There's still debate. Most research is observational, and there are confounding factors, but there's a clearer scientific consensus now than ever before. For foods that reduce cancer risk, it's surprisingly simple. Fruits and vegetables, whole grains, high fiber foods, and adequate hydration are most clearly linked with reduced risk. Despite a continually improving body of research, the major public health organizations like the WHO still don't go much further than these basic recommendations. As far as trendy diets go, you guessed it, there's no silver bullet. Mediterranean and DASH diets show almost no downside risks and lower cancer association. Plant-based and vegan diets have similar benefits so long as they're nutritionally complete and balanced. The KISS principle applies here, really. Keep it more plant-based, keep it varied, and don't go to extremes. Now to specific nutrients. There's plenty of research showing that certain micronutrients, like the ones shown here, have benefits for cancer risk, but broadly speaking, we get these benefits when we're eating whole foods as found in nature. Supplements don't reliably provide the same benefits, and they come with quality concerns. Excess sugar, particularly in drinks, is a type of macronutrient over-nutrition to avoid. This is really more because it's driving excess body weight. Artificial sweeteners, by comparison, have had a lot of cancer-related scares in public debate, but they're not believed to contribute meaningfully to cancer risk. So overall consumption of whole foods beats isolated supplementation and concern about individual nutrients by far. During cancer treatment, some of the main concerns about nutrition, malnutrition, iron deficiency, and lately an interest in how diet and gut health influence response to treatment. Malnutrition and metabolic abnormalities are common, either because of disease itself, treatment side effects, or complications. And these have a significant impact on survival and outcomes, so nutrition is critical. In general, it's the same as for anybody, though. Patients need adequate energy and nutrients. But sometimes with metabolic disorders, you have specific issues that require expert nutritional guidance. And there's some really interesting research on gut health and its interactions with cancer, indicating that we may be able to optimize nutrition and gut health support to help people tolerate treatment and fight the cancer. Let's wrap up. A lot of research on nutrition and cancer is observational. Many confounding variables exist. Research is still evolving, and anyone trying to sell a single solution is probably being disingenuous. Still, there are some persistent connections between nutrition and overall cancer risk. The good news is the basic recommendations are simple. In 2008, author Michael Pollan put it really simply in a way that I think holds up 20 years later. He wrote, "Eat food, not too much, mostly plants." It encompasses variety, whole foods, plant-forward diets, and avoiding excess weight that leading public health organizations also support. If we do that, we're kind of doing everything we can control. Thanks for listening, and here are my references.